Assalamualaikum and good morning. Hi everyone, I'm Zeti Carmila Kaman, Head of Unit at Institute of Energy Policy and Research, University Tenaga Nasional. For your information, Institute of Energy Policy and Research IPRI was officially launched on 11 August 2009 as part of the UNITEN National Strategic Transformation Initiative to spearhead research and consultancy activities in the field widely considered as niche to UNITEN. The establishment of IPRI in UNITEN is timely, as Malaysia needs to focus on the issue related to energy and environment, which would contribute to the government, corporation, and other stakeholders in making informed decisions. It is a pleasure to welcome you to this live webinar session entitled The New Post-Pandemic Normal on Sustainability, Key Pillars. Let me begin this session by introducing Yang Berbahagia Dato Distinguished Professor Dr. Rasiah, a Professor of Economics at the Asia Europe Institute, University of Malaya. He obtained his doctorate in economics from Cambridge University in 1992 and was a Rajah Wali Fellow at Harvard University in 2014. He is also a Professorial Fellow at UNU Merit Maastricht University, Cambridge University, Oxford University, Muhammad Ali Jinnah University, UNITEN, Sanua University, and Institute of Capital Markets Review. He is also awarded Celso Furtado Prize from the World Academy of Sciences in 2015 for advancing the frontiers of social science economics knowledge. In light of his outstanding, impactful contributions to scholarship, Malaysia's Ministry of Higher Education conferred him the award of Distinguished Professor in the field of economics in 2017. He was conferred the Merdeka Independence Award for Academic Excellence in 2018. Ladies and gentlemen, during this live webinar session, you are welcome to post any questions related to today's topic of discussion. Kindly type the questions in a box on your right-hand side. Now, I welcome Yang Berbahagia Datuk Rajah to deliver his presentation today. Please welcome.
Thank you, Dr. Zeti, for the glowing account about me. I wish to take this opportunity to thank the Vice Chancellor of UNITEN, Dato Professor Dr. Kamal Nasruddin Mustafa, and the Deputy Vice Chancellor of UNITEN, Professor Dr. Siti Talbiah Muhammad Sharif, for giving me this opportunity not only to hold this visiting professorship, but also to give this public lecture today. I take this opportunity as well to thank the team that has put up this lecture. We've been doing all the work like the duck, where you don't see how much of work the feed does, and they've been doing all the work behind, and I'd like to thank them, Dr. Zeti herself, Dr. Siti Indati, Dr. Amar, and her postdocs. I'd like to begin by stating that this idea of bringing together these four critical pillars, which I think are important, was something I had in mind. I had anticipated when I launched as the keynote speaker of the Sustainable Development Program at Kellogg College, Cambridge in 2016. All those four corners I had actually studied and articulated to a big audience there. And now with this pandemic that we face now, this is the second time over the last 100 years we've had a pandemic of such enormous impact with lots of victims. Since the Spanish flu of 1918, we have the COVID-19 pandemic now. And in So in making this point, I'd like to mention that these are the 4 critical pillars, I think, and they actually fit into the 17 Sustainable Development Goals the United Nations came up with. But I think that tends to be somewhat, to me, too dispersed. I'd like to look at them in these 4 variables: economic development, health, ecological and environmental balance, socioeconomic equality. To me, these are important. And what has really happened is the coronavirus or the COVID-19 pandemic has only strengthened further the need to strike a balance between the 4 pillars with strong connectivity and coordination between them. The remaining lecture of mine is organized as follows. Sections 2, 3, 4, and 5 emphasize the importance of the 4 critical pillars, while section 6 examines the relationship in a linear way between material development, the proxy I use is GDP per capita, against the other 3 critical variables: environment and ecological balance, health, and of course, socio-economic equality, before I come to the conclusions. Yeah, these are the 4 critical pillars. Let me mention that there are limits to growth in many different ways. Although, of course, the latest Nobel laureate who shared the prize with Paul Romer, that is William Nodal, makes the point, along with Nicholas Stern, that you can actually grow as you grew before each of these countries, provided you ensure that there is a constant shift from the use of fossil fuels, from the use of fuels, energy sources that actually destroy the environment, to renewable energy, especially those that are completely green. Then you can actually grow at those kinds of pace, which became palatable to many leaders of the developing countries, because earlier on they were told the limits to growth, since the famous Club of Rome publication, Limits to Growth by Meadows, and a team that came with that, financed by the Volkswagen Foundation. Now they don't have to have that sort of a problem, and therefore it became much more attractive. And there's with the Paris Accord of 2015, something like 180 over countries signed to contribute in their respective ways to cap temperature rise to 1.5 degrees Celsius over the next century. And that's something exciting, but one needs to look at it and in the context of how I'm presenting, that there is a link between these 4 variables. The second being health. Now, we now know that there's a strong link between what happens to fauna and flora in the world against what may happen to us. Of course, there is a contradiction there. There is still a lot of disagreement, even though each one of them who make this point are so convinced that they are right, that the pandemic, the COVID-19 pandemic, is actually a virus, a coronavirus that jumped from the animal, meaning real wildlife animal to humans. Now that's one position, and equally important are the rest of them who make the point that it was actually an invention from the lab. Now, of course, we are still conjecturing at this point, even though the scientists who are saying the respective 2 different versions of it are so sure for themselves that they are right. But let's hope the dust settles down, and at some point we'll get to know from the scientists the real cause of the virus which is still damaging the whole global economy. In fact, we have gone through a second wave in countries like the US, interestingly, one of the most developed countries that is facing the most severe, exceeding 2 million infections and over 500,000 deaths impact from the pandemic. Then the other corner of this 4 pillars is socio-economic equality. By that, it's not just a question of having income inequality. That indeed is one key variable that affects people's lives, but it's also how people have access to health, people have access to education, all the respective things that we classify as basic needs. I think there needs to be an equality in that. Unless this is done, you will have a serious problem. And coming back to the pandemic, we now know that countries that did not treat the poor well, or have had high sections of the people suffering from poverty, with a huge stark difference in inequality, the US included, over the last 50 years has become more and more unequal. And of course, the consequences of that in relation to what it has done to access to health, to education, has had its impact too. And another point that has come about that is very important is migrant labor. It is very important that migrant labor is addressed properly. Because if you have a dual labor market where citizens are treated much better, they have access to all these amenities, and they are also taken care of with the current pandemic. And then you have the second segment from foreign workers who are not treated very well. Several of them live in the same rooms. Now you see why Singapore has had huge spike in infections. And the same in Malaysia too. Most of our infections actually come from foreign workers. The same happening in the US, how foreigners are treated, including in their case, citizens who are not seen as in a racist sense as the core set of Americans by the current American leadership. Now, these are the set of points which I think I will make and point across to show subsequently the impact in relation to making my point about why these four pillars are critical. Material progress driven by innovation and economic growth is the first critical pillar. I mean, everybody knows that you need to have your essentials, your basic stuff, except that some are too greedy. You'll have many cases where people want to become billionaires not knowing what to do with the money in their lifetimes. But I think that that amount of consumption is necessary, and that requires material development. It is important for economies to grow so as to reduce poverty incidence and enable populations to realize their creative selves. The first thing people look at when you start is your basic needs before you think about using your brain to realize your creative self, and in that sense, focus on innovation. The countries chosen in my study to make my point in the limited time I've had have largely grown rapidly over the period 1990 to 2018, which I will show in figure 2. The global financial crisis of 2007-2008 and its contagion reduced global GDP considerably in absolute terms. The lives of both the rich and the poor were seriously affected. In an increasingly integrating world, economic crises bring more hardship to small open economies than large economies, as they actually feel the impact as external demand crashes because their economies are small, and therefore whatever happens elsewhere will have a huge impact on them. The former are more vulnerable to wild swings in trade and investment flows than the latter, which is something we felt in 2008-2009 when our exports crashed. Thus, there is a need to search for economic growth models that can prevent the occurrence of such crises. Although the latest arguments deliberated at the United Nations Convention for Climate Change, growth, economic development talked about the four important pillars, but not much actually has gone on since, as you can see from the various Davos meetings. Now, this is the picture of the countries that I'm using empirically, which I'm using empirically. GDP per capita is one of the measures, not necessarily the best measure as such, but it's one of the measures that denote material development. Down here, we have the United States, which has got a per capita income close to 60,000 US. And we are dealing with 2010 prices, which is massively that much higher than the other examples I use here. Singapore, of course, has got a per capita income slightly higher than that of the US, but I didn't include here for reasons that it's such a small economy. But I've got here China, where that's the epicenter, where Wuhan, where this pandemic is supposed to have emerged. Indonesia, which has got a population of around 270 million. Malaysia, which has got a population of 32 million, Korea 50 million, and Vietnam 97 million. It's incredible that it doesn't go by per capita income in terms of how the pandemic is affected. We will get to it in the next few slides. So the first critical pillar after material development, the second critical pillar in that sense is you need ecological and environmental balance. You need to see that the material development that we are experiencing, or in relation to how governments are promoting it, there is harmony with the environment and there's harmony with the ecology that we have, that includes fauna and flora, including the animals that has now been seen as the source of the pandemic. Three important phases of theorization can be observed in arguments on the environment. The first phase emphasizes overpopulation and its impact on limited resources. The second emphasizes limits to growth, including thresholds before populations begin to recognize the importance of the environment. The third took on the argument advanced by Harding that the universe is a global common, and therefore it wanted to start right from the beginning by acknowledging its significance and seeing that damage is as much as possible restricted. Now, the first one on overpopulation and environment, Thomas Robert Malthus, was a priest and an academic at Cambridge University. And a similar argument, although to a large extent empirically depicting the case of Delhi, the visit that Paul Ehrlich and his wife, Anne Ehrlich, visited Delhi and came up with the same sort of argument, equated overpopulation as a cause of overgrazing and mining of the resources. We all now know that population becomes smaller, or at least population growth falls, and eventually you'll see populations contracting, as is the case with the Nordic countries and Japan, when countries become more developed. So that sort of relationship is no longer tenable now. Not many people believe it, although of course some scientists think that sudden explosion in population will obviously mean an undermining of resources. Various population grew geometrically, food production can only grow arithmetically. That's the sort of argument. You will have a population food production trap. In other words, as you allow population to grow as fast as it can grow, then you will have this trap. I'd like to make this point before I move on to the other slides. I remember economic growth, and this is Adam Smith in one of his volumes. He has got several volumes apart from the main one. He makes the point, he makes this comparison. And in that comparison, he actually says that a poor Scottish mother may, at the age of 40, have given birth to a dozen children. And she'd be lucky if one survived because of the cold, oppressive winter. And even if the oppressive winter, the cold itself doesn't kill, the carbon monoxide coming from the kind of heater they used would have killed them anyway. Now, if a rich person, mother at the same age, if she had given birth to one baby, she's more likely to have that child surviving. But Scotland developed. So it's not so much resources as such. The same sort of argument people like Jeffrey Sachs and Paul Collier make now, saying that countries that are either endowed with huge amounts of resources and have bad neighbors, bad geography, like Africa. For them, the causes of poverty in those countries are largely a result of poor government, corruption, bad geography, and of course, bad neighbors. Now, you can actually expand that to Europe. I mean, everybody knows that Netherlands had such a bad time with neighbors, initially with Napoleon Bonaparte's France, then subsequently with Germany. In the First World War and the Second World War, when the tanks just blitzkrieg through, so much so that lots of Dutch created lots of underground routes and so on to survive, but Netherlands developed. So in that case, Netherlands had such bad neighbors, but the Netherlands developed. Just like talking about bad geography, that landlocked countries, it also doesn't make any sense because Africa has got Algeria, it's got Tunisia, it's got Morocco, it's got Sierra Leone, it's got Senegal, so many countries, Nigeria, Angola, Congo, South Africa, Namibia, you can name it. They all are sea-fronted. And you can also see the same case with Europe, landlocked countries like Switzerland, Austria, they are all landlocked. And yet these countries have developed, Monaco, Luxembourg, Andorra, just to make that sort of point. So today it's not fashionable, but of course, those who are not aware of those arguments seem to continue with such sorts of case. Now, the second argument, in the same vein, has been that of Mead and his wife Mead, and of course a few others, financed by the Volkswagen Foundation. We call that the Club of the Rome argument. They say that the world can only grow so much, and if you grow more than that, of course, the countries would crash. And taking that sort of argument, the West used to tell us not to cut down our trees, something that earned the irk of our Prime Minister then, that they developed by polluting the world. They're telling us not to do it those days. Now, the inverted U-shaped curve relationship between income distribution and per capita income advanced by Simon Kuznets. This is between income inequality and GDP growth. But he used longitudinal analysis rather than cross-sectional data sets. He had the history of it behind it. This is our former Nobel laureate. That inequality is worsened in the early stage of economic development, but once a certain threshold income is reached, it will improve. Now, this argument was taken on by Theodore Panayiotou. The earliest one is actually 1993, to link environmental emissions with economic growth. We can look at those diagrams, and then from there we can explain this. The logic is the utility of the environment would be low when you start, because the utility of food essential will be that much higher, and therefore humans would allow for more emissions, because for them food, those essentials are more important until a certain threshold is achieved, after which the marginal utility of the environment first equals and then subsequently exceeds that of further growth in material development, with a strong focus on food, the essentials. This is a bit like the sort of argument Keynes talked about, that essentials are basically inferior goods. As income rises, the income elasticity of food will be low, which means to say that people's consumption of essentials would grow much less than their incomes when it comes to inferior or given goods. That's sort of argument. Now, the problem with that argument has been, and I will mention now, that it actually collides, it actually clashes with what we refer to as the global common. Harding, in as much as this argument came about in 1968, the environment is seen as a global common. Whatever happens in any part of the world will have a bearing in other parts of the world. So you can have a country that really believes completely and ensures that the whole energy supply comes from clean, green sources, but the borders are porous, they are permeable. What that would mean is that any other neighboring country that pollutes will obviously send the pollution to a clean country. It's a bit like what Malaysia and Singapore had for several years experienced from the haze that comes from Sumatra, flying over the Straits of Malacca, or for that matter in eastern Malaysia, where the haze from Kalimantan has had lots of deleterious effects on Sarawak and Sabah's environment. Hence, issues related to the environment is now recognized as a key pillar in achieving development, because you cannot expect for every country to reach a certain sort of threshold, after which then you see it to go down, even if they're growing, because it is a global common. In that sense, Nicholas Stern and Nordhaus, the 2018 Nobel laureate, have shown that global temperatures are rising at dangerous levels, and unless something is done to slow down that drastically, planet Earth may go extinct. And this is the point, actually, I must say, I first saw when I went to give this keynote speech in Cambridge. I saw this huge banner hung in front of Gonville and Keith, where he lived, and I was there before I gave this lecture, and he was predicting the end of the world in 60 years if something is not done. In fact, he was actually recommending that humans make an attempt to relocate to Mars. And man, it will take something like 20 light years to reach Mars, and how many of us can actually relocate there? He said that in his point, he made the case that we have damaged the world so much that it's almost impossible to save it. But he did make the point that the 60 years may not be the only limit. You could extend that to 100 years, but beyond which I think he didn't see a real possibility that Earth would survive. They also offer convincing evidence to show that climate change and global warming can be stopped if human activity is shifted from the use of fossil to environment-friendly practices. And you can still grow very fast. And this point about the 1.5% Celsius capping of temperature over the next 100 years, I mentioned this earlier. Now that actually attracted nationally determined contribution to the United Nations Framework Convention for Climate Change. In the case of Malaysia, among developing countries, 45%, with 35% coming from our own efforts, which in Malaysia, we see the introduction of large-scale solar supply. The previous government was instrumental in 3 of them being launched. And of course, the current government has launched the 4th with a supply capacity of 1 gigawatt of solar panels. Now, among the target countries have focused on to achieve economic and environmental focus is to raise the share of renewable energy on total energy consumption, which has actually picked up steam from 2010. You can see this renewable energy in total energy consumption of the countries that I have placed in this study. All of them show a trend decline except for Vietnam, which is a late entrant as a country that was communist earlier, and then from 1986 looking to reform, integrating with the world economy. So that seems to be quite understandable. And of course, the example of China in some of these years. Although China has actually shifted extensively to renewable energy, which shows there. In fact, the last figure that I have is 2019. Something like 46% of China's energy consumption comes from renewable energy. Now, the next pillar, health. The pillar of health has to focus on checking the spread of infectious diseases as well as shielding people from non-infectious diseases. For brevity, we use hospital beds per 1,000 people. Medical evidence shows that the incidence of health problems are encountered more by the poor than the rich, and which is also obvious with the current pandemic. The poor and the migrants are the ones really facing the brunt of the crisis. The provision of healthcare has varied across countries, with privatization increasing far more in the developing countries, interestingly, which has actually exacerbated access to health. Johns Hopkins University Center for Health Equity has argued that poor environment has been indeed a major cause of all these problems. And systemic risks with regards to epidemic breakouts, which is a smaller way of dealing with health compared to a pandemic, which is much more uncontrollable and goes beyond borders. There is recognition now that the world is connected, so that the sufferings of groups of people will have a bearing on the health of society as a whole. The spread of HIV/AIDS is one example. Improving access to provision of adequate healthcare is a key component of sustainable development. For healthcare to reach all humans, its provision should address the problems of concentration and its provision and R&D in that sort of area. Whereas the first denies those in need among the poor and disadvantaged, the latter reduces resources targeting the diseases of the poor. If you focus all on what money can buy, then you will have less money going to TB, to pandemics like this, and to AIDS, diseases of the poor, mainly the poor. Now, this is the distribution of hospitals beds per 1,000 people. I will come back to that later. This is socioeconomic equality, the last of the variables which I think is critical. The world has largely faced worsening intra-country and inter-country inequalities, regardless of the location of countries in the development phase. We use income inequality as a proxy to represent socioeconomic inequality. Of course, you can use many others, though you can also use access to education and public utilities. Inequality causes unequal access to resources, which would undermine the capacity of the poor to compete with the rich in the allocation of resources. The rich have access to capacity, and therefore can gamble on theirs directly and indirectly. The poor's future, as the channeling of savings to speculative activities, can easily cause asset bubbles, which, as it explodes, will bring a cascading effect on the real economy and the key development indicators we just discussed earlier. The poor lack access to sufficient resources to enjoy essentials and the know-how to combat diseases and to also avoid causing harm. Unequal access to education, health, water, power, and technology has been a major cause of worsening rural-urban, gender, and inter-region and inter-country socioeconomic divides. Efforts to check inter-country inequality, albeit minor, can be learned from the European Union's offer of technology to the least developed countries in Africa and Asia to improve food sterilization, sanitation measures, and so on. And much of this is actually done for free. Malaysia has also been assisting several least developed countries through G2G arrangements in the fields of agriculture, education, and science. And I think this should be extended far more. This is the income inequality experience of the different countries here. Because there's no sustained annual data as such, this is what I could most largely get. It shows in the case of some countries like Indonesia, a trend worsening, and then of course falling slightly, the Gini coefficient, which itself may not be the right measure as such. One could use the Palma index, which talks about 1% of population of the top 10% against the bottom 40%. But in the interest of time, I've just used this as an example. Now, linking material development with critical pillars. The general trend has been on mature economies demonstrating a strong link between the three pillars. In this section, we show the link between economic development, deploying GDP per capita, environmental, health, and socioeconomic variables using countries with varying levels of economy. I could have put all the four variables there, but that will only complicate matters because it will take a long time to explain, and the time doesn't really provide. If those who are interested, they can always write to me because I'm looking to prepare a scientific paper in that sort of direction. The countries chosen are the United States, China, developing China, rapidly industrializing populous country, Korea. The reasons are given there. You can look up for yourself. The coronavirus pandemic does not show a significant relationship between material levels of development and infections and death rates, which is a consequence of the nature of the pandemic. The disease has been spreading through contact while countries' responses have been very much dependent on lockdowns and resources put out to screen and test. I will come to that because some of these countries that are the poorest there, they have done much better. The evidence in relation to ecological balance for the share of renewable energy consumed in total energy shows developed countries have passed the threshold, including the United States, despite Donald Trump revoking what Obama had done in signing the Paris Accord. He had actually broken that, opened up free coal mines and gas exports as well as oil exports. Upper middle income and newly developed countries appear to have passed this threshold recently, though UN SDG initiatives have also been significant. Poor economies appear to be facing a fall in the use of renewable energy, which includes Indonesia and Vietnam. Obviously, they are not in a position to devote that much of resources to the environment, which is somewhat lacking in that sense, somewhat troubling, because it's important that they actually address those kinds of issues, even if it means it may actually compromise further on their growth rates. This is the example that I have for China, which is shown as sharp fall actually in that sense, and then subsequently it has improved. You can see over the last 2 years it improved. In fact, it has improved steeply over the last 2 years, which is not here in the picture, which is incredible for a country with such a population. Renewable energy, and this is the case of Indonesia, it's relatively gone down and it stayed flat. It doesn't show any rise. Even the last few years, I tried to get data from them, doesn't suggest that they are moving in the right direction. This is the case of Korea. You see a worsening first and you see a trend rise, and the rise has been steep, the use of renewable energy. Even though the share is very small. If you look at the y-axis, the share is still very small, but at least it shows a trend that is improving with GDP per capita. Renewable energy and GDP per capita, the case of Malaysia, we have worsened until a certain point in time, then we have been improving. We can see from the expansion, the proliferation of large-scale solar panels and attempts to stop dams and so on that has gone on. So we have shown a trend rise. It's my hope that the current government will continue this. Renewable energy, this is the case of the United States, despite what especially states like California and so on, there has been tremendous improvement in energy sources, so that they have been shifting to greener energy, even though you see the government has actually lifted controls on fossil fuels under Trump. Renewable energy, and this is the case in Vietnam. I mentioned, maybe because the country is still very much undergoing premature development at the moment, even though it's growing rapidly. It's got a per capita income of almost 2,000 compared to Malaysia's 12,000, and about 57,000 for the US. Now let's come to health indicators. Korean Republic and China show a significant rise in beds per 1,000 people. This is the only two states that show a significant rise. Indonesia showed a rise in beds, then subsequently it goes flat. It's stagnating. Malaysia's curve is flat, but further investigations show that that's largely because of unutilized beds and so on, and of course an expansion in the private hospitals that obviously limits the capacity of people to access such healthcare services. United States is an alarming case, a country that continues to grow rapidly, but over the last 50 years has become more and more uneconomic. Here is a country where the beds per 1,000 people has worsened. And let's just go through the figures directly so you can see the evidence. Now, here we have the case of China. You see a steep rise in beds per 1,000 people. In other words, despite the lack of freedom that people may think they should have in democracies, you actually see access to beds. As a measure, one of the proxies, I couldn't use too many here, but in many facets they've actually improved, and the rise has been quite steep. Now you look at the case of Indonesia, it improved considerably over certain years, and then of course it remained flat. This is the case of Korea. Korea shows a trend rise gradually, right from the beginning. It shows a trend rise from 1990, which is something, and it's got a higher share of beds per 1,000 people against GDP than even China. It's got the highest in the world, even compared to the US. This is the case of Malaysia, which is somewhat flat, which was actually improving a lot before 1980. It could be partly because of privatization, or it could also be partly due to the fact that they had excess capacity earlier. This is the case of the United States. You see a trend decline from even 90. In fact, if we go further, there will even be even more of a decline. So that few people have access to beds there compared to Koreans. That's quite obvious, and it's going down further. This is the case of Vietnam. There's a scatter diagram that doesn't show any pattern as such, which I say is because of recent experience with development, even though GDP is growing rapidly. Socioeconomic inequality. Let's go directly to in the interest of time, to look at the evidence. This is the case. Right? This is the case of China, which has worsened, and then subsequently Gini coefficients are falling, gradually falling, which seems to be a situation of integrating with the capitalist economy. What's happening? Why is it running? Up, doesn't go. China. Okay. It has shown worsening when early integration to the capitalist system, then of course there's been an improvement since. Indonesia too shows somewhat of, especially after the fall of Suharto, it has been worsening first, and then subsequently there's been slight improvement. This is the case of Malaysia. I think a lot to do with the BRIM that we gave. There has been a substantial improvement. 0.399 was the last figure that we have for 2016, as well as 2018. BRIM may have been the reason why Gini coefficients fell. In the case of the United States, you see a worsening here, a trend worsening. The example that was mentioned to you, over the last 50 years, a very developed economy is demonstrating a continuous worsening of income inequality. Vietnam, again, doesn't show any pattern for the same reasons I had explained earlier. Now, if you look at the pandemic, this is the point I was making earlier. It has no reflection, no connection with material development. A country with a per capita income, and this is in 2010 prices, don't forget, and the current prices will be that much more. This 2010 prices, the US is something like 55,000 against China's almost 8,000, Indonesia's 4,000, Korea's 27,000, Malaysia's 12,000, and almost 2,000 for Vietnam. And we look at the infections, massive in the case of US. This is the June 6th figures. It's more than 2 million in the case of United States now. China also facing a slight relapse, but this time coming from Beijing. Indonesia obviously now exceeds 50,000, but see how fast it's grown in June itself. And the case of Korea down here is 12,000, Malaysia 83,000. We are doing really well in that sense. I have to thank Dr. Nur Hisham for his leadership here. Vietnam 329,000 infections still, and people think that maybe they were not tested, maybe they're not telling the truth. The WHO was there, and therefore we should accept that figure. Largely because they were very quick to deal with it, and they actually focused on an egalitarian society. The deaths, Vietnam has 0 deaths for 97 million people. You see the case of the US, the worst example down here. And if you look at it per 1,000 people, massively that much higher in the case of the United States. It's not showing any signs of falling. In fact, the relapse seems to suggest it's going up. The same with Brazil, Russia, and India. It's surging, those figures are surging. Now the epicenter, China, 3 per 1,000 people. Indonesia 7, Korea 5, Malaysia 4. Of course, New Zealand, Taiwan, and so on could be brought here because they have also done very well. This is also a reflection of the fact that you have to address all those 4 variables. Environment, I mentioned, health. Health is a very, and inequality. In the case of Singapore, which I didn't include here, the migrants themselves are facing a dual labor market, just like Malaysia in that sense. I think if we understand the concept of global common, we must accept that we cannot treat them separately. It will have a bearing on us even if you are selfish. Now, let's come to the conclusions of my presentation. I know I may have presented certain things either too technically or too fast, or I may not have clarified something sufficiently well, but you are entitled to question me subsequently. I would have preferred you stopping me to ask questions during the lecture, but with a webinar, it seems that that's not possible. This lecture attempted to emphasize the critical relationship between the 4 pillars I mentioned: material growth, ecological and environmental balance, health and socioeconomic equality. Though for brevity, it limited the discussion to particular proxies, because otherwise we'll have to spend 3 hours here. The rise in renewable energy as a share of energy consumption shows improvement in the United States, despite the president himself not showing the leadership there. The Korean Republic, China, and Malaysia. However, Vietnam shows a skewed rise in the use of non-renewable energy, in fact scattered in many ways, while Indonesia has yet to enjoy a rise in renewable energy in energy consumption, despite the fact that they are planting large areas with jatropha and so on. Hospital beds intensity has improved in most of the countries, with Korea and China showing the biggest improvement. In fact, the intensity of beds per person in Korea has risen that much, more than 3 times higher than the United States, the most developed country among the cases that we are using. However, it has worsened in the United States, which seems to tie with worsening inequality in the country. The worsening inequality, with the poor becoming in many ways relatively poorer, that seems to have been also the reason why, apart from handling is a major problem with the kind of leadership the president has given, why the pandemic has been the worst there. You are dealing with something like a quarter of those infections resulting in death. A quarter of infections in the world coming from the US. And it doesn't show, it's relentless. It doesn't show to any sign of relenting in that sort of sense. And now we see a second surge of infections, and this one involving more other states than the states where better control has gone on, like New York. This is a reflection, and again, other countries that have somewhat taken in some in the American sort of line that have been really falling and doing terribly here in Brazil. Brazil under Bolsonaro has shown no leadership whatsoever, and it's also now reached the Aboriginal people in the Selvas, which is the Brazilian rainforest, and it's incredible what damage that would do. The evidence also demonstrates that the relationship between material development and the remaining critical pillars evolve over time. However, while China, Indonesia, Korea, and Malaysia have enjoyed improved income distribution, the situation in the United States shows a trend worsening. Vietnam showed no relationship, but that's to be expected in relation to the developmental status of Vietnam. Let me then make this case. The evidence, even though I've only used 5 countries, you could actually extend this if there's much more time to the world as a whole. And to me, that simply points to what I had anticipated when I presented the keynote speech in Cambridge in 2016. This time around, I have actually provided much more data, much more analysis to make the point, except that I haven't extended it to the world, which can be done easily, except that the time for presenting it is not available here. But if there's anyone who wishes to connect with me to see how the scientific paper of mine is progressing, I'll be very happy to share those findings with you. But let's accept that any government that is looking at a population, and it cannot look at it in a detached manner. In however much you want to be selfish in protecting your own population, the environment is a global common. We know there is a huge link between environment and health. If you don't take care of the environment, it's not just about having flu, coughing around and so on, but the pandemic is a consequence of that as well. You can have all these invisible enemies that would come to destroy it. So I think it's important we address those things, and we also need to address inequalities. Simply because resources are limited, the study of economics itself talks about a good being economic only when there is scarcity. Now, in that sort of sense, if you divert resources to whoever that can only buy those resources, who are happy to buy because all these big advertisements, marketing stunts by companies to make money, now you will actually deny the poor of resources, and that will have a serious impact on populations. With that, I'll pass the cue back to the moderator. Thank you very much for listening.
Thank you, Dato Rajah, for your insightful presentation. Now I would like to read the questions posted by the attendees previously. So I proceed to the first question. Hi Dato, thanks for your excellent talk. I understand that Malaysia will suffer about 800,000 new unemployed workers during post-COVID-19 pandemic, expected by October 2020. What do you suggest to the current government to address this critical issue, particularly for those in the bottom 40 group? Thanks a lot.
Our Prime Minister actually is concerned that we are likely to have unemployment rising by 1 million, which is even more. Tan Sri Muhyiddin Yassin actually mentioned, and those figures come from the Stats Department. And I still think that those figures are a conservative measure. I feel the numbers will be somewhat more, but it's a good question. Now I think in the context of the lecture that I gave, we're dealing with 4 variables, but now it has really come down to how we debate this as 2 variables. On the one hand, if we are dealing with material progress. If we don't deal with economic growth, if we don't open up the economy, stop the lockdown, the argument will be there will be more unemployment. GDP will contract, factories may not be operating at full capacity, workers, a lot of them will be regulated so tightly that not many of them are fully functional. Then on the right, and on the x-axis, you have the pandemic itself. At the moment, it's improved tremendously. Some days we get 3 infections, some days we get 6, although sometimes it goes up again to double figures. But that's a good sign. But the worrying problem is how much of contact will this actually lead to if only we open up the economy that much more for it to be fully functional. Now, economists tend to take this view that we have a V-shaped curve, which means to say we should allow for this contraction to really go down from to a recession, and if the contraction continues for more than 2 quarters, then it becomes a depression. So that we deal with the disease first, get it out of the way, then we have a recovery, a V-shaped curve, and of course, then you will have explosive growth again. Now, I think we need to be concerned with that sort of understanding of the world, because we have to rely on the scientists. The scientists are saying, and this is demonstrated now with the second relapse, second wave of the pandemic in the US, for example, we see a resurgence of the virus. Now, I think instead of thinking about the V-shaped curve, we should actually be thinking of the W-shaped curve, or maybe another sign that shows in case there is even another upswing and a downswing in the infections. But my feeling here is we need to open up the economy. I agree in that sense with the question that's posed, but also with the Prime Minister. But we have to be careful. We have to be careful, and I think in that sense we are given good direction by Dr. Nur Hisham himself, because he's actually, in my mind, not just a good surgeon, but he's also demonstrating the capacity, the ability to manage in relation to the social requirements of how this would actually impact the economy. So my feeling is the areas that they could do well in doing is to open up all logistics, but make sure the SOP, standard operating procedure, is followed with all those criteria to put up and followed strictly, so that we don't let it permeate clusters from one to another. That sense, I think Dr. Nur Hisham has done well, identifying clusters on the basis of infections and then circling them out. I think that should be maintained, which also explains why Vietnam has done very well. It has got no deaths, very low infections for a country with 97 million people. Now, I think so long as we follow that, logistics should be open, and many other factors can also be open, provided SOP can be maintained. Less interaction between people, social distancing is followed strictly. I think that should be the way to go.
Okay, thank you, Prof. Now we proceed to the next question. What will be the most sustainable and win-win solutions in kicking back the economy after the COVID-19 phase?
We have to first recognize history. The global economy was already slowing down, largely this time because of the trade war between the US and China, which means to say we were struck with this pandemic at a time when the economy was slowing already. So we cannot miss that, detach that wave that caught us when the pandemic struck. We need to understand that. That actually also meant that countries were experiencing a reshoring of production. China, as a great vacuum cleaner, a supplier base for the world, was losing its attractiveness because US, being a major market, was denying China with tariffs and quotas. So you already saw a relocation of production from China to Vietnam, to Taiwan. Once we see the proliferation of Industry 4.0 technologies, especially the introduction of artificial intelligence through robots and drones. That was already happening. The pandemic has only heightened that and intensified that. That not just further relocations back to Taiwan, but also to Japan. The Japanese government announced 2.1 billion US to assist firms to come back to Japan, as well as to relocate at major markets, Southeast Asia being one of them. Now, I think all that are possible. We need to take advantage of those things because of disrupted supply chains. At the same time, importantly, I would think we need to plan more effectively. Remember, FDI by itself is not a panacea. This assumption, some mainstream economists say that all you have to do is open up, liberalize, bring all this FDI. They know what to do. They have the best technologies and so on. They will use our workers and we export. I think that sort of argument no longer holds. We need to make sure, and Malaysia is not a poor country. We are not a capital scarce country. We are also, most of the time when we have low levels of inward FDI, or rather net FDI, it's because we have outward FDI that is going out. I think we have to focus on seeing where our niches are, where we do better, or more importantly, potentially where we can do better, rather than what we can do now. We can think about all these industries in which we can do better, bring all the better brains, professionals in particular, provide the right sort of infrastructure, and see that they are monitored, the right players are being selected, even if you say provide incentives and grants, because you have to take out those who don't perform. It's not easy to identify ex ante the provision of those incentives, but we must remove them if they're not performing. And if they are breaking regulations, then we have to penalize them. This is the carrots and sticks approach that Korea and Taiwan use, and they are all developed. These countries are developed, and many of their firms are at the frontier. We have to do those things now. We cannot wait that much longer, and making sure that the 4 variables I mentioned earlier as critical are observed. Then I think we can.
Thank you, Dato Rajah. And I think this is the last question for today's live webinar session. Energy decisions are influenced by economic factors. In your opinion, how the negative impact of COVID-19 will influence the energy efficiency initiative by our government?
Our government actually, I saw this in relation to how reports were being done in the 90s itself. Energy self-sufficiency at that time included focus on nuclear power. Now, nuclear power has lost some sort of steam, largely because of the Chernobyl incident that actually quickened the development of solar panels by Germany, for example, which became the route through which China actually gained much of the technology. And at the time when the US launched, they didn't realize that China was already mass producing it, and therefore a lot of their countries lost money. Now, then the Fukushima incident. Not that nuclear energy is dirty energy, no, but the dangers of having nuclear power. Although we know even in Europe, Germany is against it, but it imports a lot of this nuclear energy from France. But that aside, the pandemic itself, I hope, does not deter. I can only mention that. And there are signs to show the current government, PN government, it's actually observing it, because it's already announced the 4th large-scale solar supply. And this time around, unlike the previous 3, that amounts to something like half a gigawatt, which is 500,000 megawatt. All 3 together, LSS1, LSS2, and LSS3 amounted to. The current one, the 4th one, the announcement government made is to generate 1 gigawatt capacity of power. So that obviously shows that I think the current government is taking that seriously too. And remember, Malaysia made a pledge, just like those other countries that signed the Paris Accord in 2015. They made a pledge, and then they had this internally intended determination of contribution by the different INDCs, intended nationally determined contribution, and we pledged to reduce carbon emissions by 45% by 2030. And in terms of renewable energy, the target we had set was like 20% of our total energy consumption by 2025. So in that sense, I think it should not affect at all the direction that we have set, the roadmap that they've put up to pursue renewable energy. And further good signs I should point out here is the countries, of course, the US revoked, but the countries that are still there in making sure that they no longer had any internal combustion engine, the conventional cars that we all use. By Europe and Japan, they have maintained, they will end it by 2040, suggesting that the focus on those kinds of fuels and so on will not be resumed. Likewise, the Malaysian policy scene hasn't seen any drastic change in that sort of pursuit. So that's a good sign. I hope they don't change.
Thank you very much, Dato Rajah. I think we need to end our Q&A session. As we are running out of time, we are not able to answer all questions right now, but you can always reach out IPRI and Dato Rajah through our website. You can also download the slides from Q&A control panel or IPRI website. We would like to thank distinguished Professor Dato Dr. Rasiah for making time for us today. Ladies and gentlemen, it is just as much of challenges at the national level, where many of the policy decisions in response to the pandemic are made, and at the local levels, where people decide on whether to comply with government guidelines and whether to support one another in this time of need. Every one of us holds great responsibility for the health and well-being of others, not only for current living, but also for future generation as a whole. Don't forget to give us feedback on today's live webinar session. The link is provided in the Q&A box, or you can scan the QR code on the screen. For all attendees, thank you again for your participation. Be safe, feel safe, and stay safe. Thank you.